Distinguished ladies and gentlemen, dear friends, what happens here? Dear friends and colleagues, I really want to thank Sean and the organizers for inviting the African Union Commission. Just last, I think April, our previous chairperson of the commission, Dr. Dlamini Zuma, left us, and she's back in South Africa. I had the privilege to also work under her and her colleagues in the Department of Social Affairs. Well, she was our chairperson, but really, thank you, Sean, and thank you for TB HIV Care for inviting us. I also have my colleague, Jane Marie here. Please, Jane, stand up. She is the manager of the AU Plan of Action on Drug Control the past 6 years, and you will see much more of her also over the next few days. I also see Jamie Bridge here and others whom we've been working very closely together with. I also see my brother Pelmos there, Professor Ratamani and his wife. It's great to see you. We've worked together many years ago, and I understand David Bayever is also here. I don't see him now, but I met him in 1989 when we were starting the Drug Action Group in Windhoek, which is still a strong organization, CSO in Windhoek, and still going strong. So it's wonderful to see old friends here. So I bring you the greetings of our current chairperson of the AU Commission, Mr. Musa Faki Mohammed, and also the Commissioner of Social Affairs at the Commission, Mrs. Amira El Fadil Mohammed, who took over from the previous Commissioner for Social Affairs in March, I think, Jane, in March. So she's with us a few months already. I can just say this conference is very timely for us at the AU Commission for 3 reasons. Firstly, as you may know, on 12th July this year, the SADC Parliamentary Forum came out with a resolution for SADC member states, the 15 of them, to please review your drug master plans or national drug strategies in view of the support, not punish policy. I think that was a wonderful breakthrough. And already, so I really want to thank Sean and others who've been behind this for this very important decision to come through. Already Namibia and Botswana asked me to, Uncle Johnny, now that you have been retired, but okay, we know you've been recalled to others again, please come and assist us with this. And I hope before the end of the year we could already craft one for Namibia. So I'm very happy for that. And secondly, as you may know, we have the AU Plan of Action that I referred to earlier, 2013 to 2017, and it has been reviewed in line with the UNGA's outcomes. And this conference will really help us to put together a template for all AU member states to follow, to be in line with this new thinking. Then the other good news is we are also working, and I'm personally working with a few experts. The Executive Council of the AU asked us to come up with a protocol to the African Charter on Human and People's Rights, and this protocol is on the rights of citizens to social protection and social security. And I promise you there will be an article among other vulnerable groups also for drug users. So that will be maybe a new thing that will also help drug users through their treatment period and thereafter to have access to social security and social protection in the form of cash transfers, whatever, like any other vulnerable group, persons with disabilities, older people, etc. will have. So we are fighting for that also, and maybe we'll have to sit, Sean, and craft that article. So that is the third reason why I'm so happy about this meeting. And it also ties up very well with the common African position, which was spearheaded by Honorable Deputy Minister Henrietta Bokopane Zulu from South Africa. She was the chairperson of the AU Specialized Technical Committee of Ministers on Health, Population and Drug Control. And as you know, she got a standing ovation in New York when she came up, when she read the African Common Position. And Jamie and everybody, Sean, everybody was part of this. So I'm just concluding now with the end of my presentation on Thursday, and the slide says, as for the 2019 Political Declaration and Plan of Action, Africa is ready to adopt a more health and development-oriented interpretation of the UN drug conventions, especially Southern, Eastern, Western and Central African countries, showing, number one, great support for prevention, evidence-based treatment, care and harm reduction, and secondly, the role of civil society strengthened towards health, harm reduction and development issues. So on that point, please come Thursday morning and we can talk about more on the African response. Thank you so much, Sean, for having us here.